thought it wasn't going to get worse, it sort of did. Let's look this from the, oh my God, Zero Hedge. COVID-19 infects Iranian vice president, kills Iran ambassador to Vatican. I didn't hear this on Good Morning America, obviously, or the nightly news. Of course not. Why? Who knows at this point? This is from the FARS. That's the government news agency. It says, oh, look at that. Iranian ambassador to Vatican has died from COVID-19. Prominent Iranian cleric, diplomat Hadi Khosrowshahi passed away today, one day after he had been admitted to the hospital in Tehran for testing positive. He was Iran's ambassador to the Vatican and later Iran's top diplomat to Egypt between 2001 and 2004. Says, nothing says we got this under control like confirming that a handful of your government's most senior officials have caught the virus at the root of a deadly pandemic sweeping the globe. After confirming that Thursday this official death tolls from the outbreak had reached 22 with 141 cases confirmed, lawmakers have claimed that the death toll as Monday was up to 50 in Qom alone. Iranian state media reported that the country's vice president for women and family affairs, that name, has tested positive for the virus. She is the third senior official to be infected alongside deputy health minister and cleric who succumbed to the pneumonia due to his advanced age. Okay, so he didn't necessarily die from the virus, but it didn't help his pneumonia when he got it after he got the virus. As an immunologist, the important point I want to make is the COVID-19 outbreak is a health issue that requires experts' evidence based on observation. Fake politicized news or posting can be life-threatening. WHO and health ministry protocols should be taken seriously. Yeah. Iran canceled Friday prayers in Tehran on Friday as... That's a weird way to say it. As the virus spread further into the capital city, with Iran's economy badly damaged by the sanctions, which also contributed to shortages of essential supplies, including medicine and medical products, which is uniquely vulnerable to the virus's devastation. And more of the regime scrambles to try to contain it. The further it spreads, Iran's neighbors close their borders to its citizens and turn away from the Middle East's worst virus hotspot. And as more government officials fall ill, we can't help but wonder why. How much longer will until the Ayatollah gets sick? And that was some Zero Hedge. Compounding every this, the stock market took a deep hit since as bad as it was since 2008. Financial pain deepened as nearly 60 countries report the virus. I think it's 54 right now. A deepening health crisis. At the list countries being hit, illness edged towards 60 with Belarus, Lithuania, New Zealand, Nigeria, Azerbaijan, and the Netherlands reporting their first cases. The threats of livelihoods were increasingly eyed as warily as the threats to lives. It's not cholera the black plague, said Simon Venturini, the city councilor for the economic development in Venice, Italy, where tourism, already hurt by historic flooding last year, has sunk the news of virus cases. The damage that worries us even more is the damage to the economy. Yeah. Tedros Adhanom, that guy, director of the World Health Organization, said the outbreak has pandemic potential. But whatever terminology officials use, the rippling effects were clear. Attractions, including Tokyo Disneyland and Universal Studios Japan, announced closures. Wow. And events that expected tens of thousands, including a tour by K-pop group BTS, were called off. Can't have BTS fall ill, apparently. Investors watched warily as stocks fell across Asia and girded itself. Wall Street's brutal run would continue, while businesses, both small and large, saw weaknesses and people felt in their wallets. Yeah, as you can see, globally there are more than 83,000 people have fallen ill with the coronavirus. China, though the hardest hit, has seen lower numbers of new infections with 327 additional cases reported Friday, bringing the country's total to 78,000. Another 44 people died there for a total of 2,788. South Korea has recorded 2,337 cases, most outside China. Emerging clusters in Italy and in Iran, which has had deaths at 34 and 308 cases, have in turn led to infections of people in other countries. Yeah, even there was a case in California, I think yesterday, that popped up and he had no connections. So there's somebody floating around in California that's been infecting people. So and I think he was tested a couple times before that, and he was okay until he wasn't. Wow. And then speaking of Nigeria, which is a hotbed of disease, not necessarily in the city, but outside. Residents of Nigeria's economic hub, Lagos, scrambled for hygiene products Friday after chaotic megacity of 20 million announced the first confirmed case of new coronavirus in sub-Saharan Africa. That health minister said in a statement overnight that the infected person was an Italian citizen who flew in from Milan. Oh, there we go. So Nigeria was fine until some scamp from Italia decided to roll in there and say, "What's up?" The patient is clinically stable with no serious symptoms. The low number of cases so far across Africa, which has close economic ties with China, the epicenter of the outbreak, has puzzled health experts, specialists. I have no reason why that would. Prior to the case in Nigeria, there had been just 2 cases on the continent in Egypt and Algeria. Nigeria, Africa's most populous country with some 190 million people, is viewed as one of the world's most vulnerable to spread the virus given its weak health system and high population density. That's what I was getting at. Worried inhabitants of Lagos, a city that is hit by West African Ebola epidemic in 2014, were already flocking to pharmacies Friday morning in search of hand sanitizers and masks. Again, if you don't have the right mask, you might as well not even wear one because it's not going to help. We are sold out. Masks are scarce. One customer refused to shake hands. He said he was struggling to buy hygiene products. That's sad when you can't even buy soap. Biggest concern today, the first confirmed case of sub-Saharan Africa appears to be giving the region a chance to get better prepared, with more than half of the country's established laboratories to diagnose the virus. But WHO has still called for for the continent to come together to be more aggressive in attacking. We have continued to beef up our own security. The level of preparedness continues to improve in Nigeria every day. Lessons from Ebola. Okay, here's the interesting part about this. Dog test positive for coronavirus and quarantine in Hong Kong, sparking fears pooches could spread the killer bug. Great. That's all we need for that part of the world to have hate dogs more than they usually do. The owner of a dog, Yvonne Chow Hua Yi, who lives in Hong Kong with her beloved Pomeranian, tested her pet pooch after being diagnosed with COVID-19. The dog has been quarantined by officials such that they have concerns that the pet could pass on the disease. Well, that makes sense. We're both animals. We share some DNA. Not everything, but there's some parts of it that we share. Just like every other animal. Makes sense, wouldn't it? Like they said, the virus didn't. They said the virus ended up in the food market in Wuhan, but it didn't necessarily come from bat soup. That's what they're saying. But again, are we going to believe what the Chinese say or the Iranians say? Nah, I wouldn't. I mean, those people will lie to save their own skin. And it took China, a month for them to finally admit that they had a problem? So, again, are you going to believe China? I don't know. The department spokesman confirmed the Pomeranian's nasal and oral cavity sounds were tested weak positive for COVID-19 virus. However, it did not explain why they tested the animal in the first place. Think about that for a second. Why would they test this animal for the virus out of the blue? Makes you wonder, doesn't it? If they don't know something that we don't know. Just playing a thought experiment here. Just saying. The dog, which is not yet exhibiting any symptoms, has been quarantined in an animal shelter that is holding no other animals. It will remain in the shelter for 14 days and going to undergo repeated tests as officials try to confirm whether the dog has really been infected with the disease or was a result of environmental contamination of its mouth and nose, which would make a lot of sense that if it was the case. The owner, said to have developed symptoms a week ago, was diagnosed with the coronavirus 5 days later. So I guess either it passed from the dog to the human or the human to the dog. See, while officials state there's no evidence showing the animals can be infected with contaminants of the virus, there has still been links to COVID-19 and animals in the past. But Professor Jonathan Ball, University of Nottingham's molecular virology unit, there is no evidence that human novel coronavirus can affect dogs, and it would be incredible for a virus to make so many species jumps in a short space of time. Well, you tell that to the ever-evolving virus that it can't jump from different species to species, okay? Because, that just never happens ever, and it couldn't, right? We have to differentiate between real infection and just detecting the presence of a virus. They are very different, and the fact that the result was weakly positive, which suggests that the environmental contamination or simply the presence of coronavirus in human contact, that was in open dog samples. And you see the virus spread started in China, right here, South Korea, and then it went, it's all over the place now. But luckily, in the United States, where I'm more concerned about it than anything, no one has died yet. However, given the disgusting virus-infected San Francisco, California, where it could spread pretty easily, which you've already had medieval diseases pop up in Los Angeles, it's rife for that sort of infection to occur. So, bats are a possible cause of the coronavirus, research suggests. And you got a head. So what is this? So where do we come into conclusion with this? Well, prepare now. There is none of this, well, I don't know if you prepare. Go out, buy at least a month's worth of food, at least. And for you Second Amendment aficionados, I would go out and make sure you have enough ammunition, if you will, because you never know who or what people will do when they're pushed to the edge. I'm not saying, take the law in your own hands, but I'm just saying be prepared, not only with food and water. Make sure you, like what the CDC was saying, which makes a lot of sense, wash your hands a lot. I would probably avoid large gatherings of people. But I would still continue to go to work, and that's and all that. I wouldn't necessarily change your daily routine unless you come across some guy who's coughing up a lung. I would probably dip out. Just saying.
No eggs. No empty egg carton. You don't have any